when we're talking about like bilateral arrangements, right, the 90 days, to which the 90 days applies a reassessment, PEPFAR, this 43 billion, it goes to what? ARVs, condoms, you know, what does it cover, Dr. Mwangangi?
Yeah. So the 43...
Practical terms, basically, what are we saying?
So 43 billion is supporting the procurement of commodities that we use in Kenya. When we look at ARVs, there's a whole range of different types of ARVs from different kinds of treatment regimens. Those are procured through that support. When we think about all the capacity building efforts that go into introducing these regimens in the 13,000 health facilities we have in Kenya, with almost 100,000 staff, all those need to be trained, and that money sits there. When you look at response money, when you look at family planning money, when we look at resources that help us in ensuring that we're looking at access to different, how do I say this, health system building initiatives, such as ensuring our health information systems are working, ensuring that we are tracking our TB default cases, ensuring that we are following up our mothers who may be HIV positive and have missed their ANC clinics. So it's actually tremendous, tremendous support that is so, so vital to the workings of our health systems, both in Kenya and in Africa. And Olive, I hear you when Dr. Matenjitara says he's a bit, you know, half concerned and half not concerned. But remember, for our own country, Kenya, for every 1 shilling we're spending on debt, we're only spending 0.3. 0.3 on health. Now imagine pulling out 43 billion. What does that leave with us? You know, what does that leave behind? And so what we are really championing, really, at the end of the day, what are the alternatives? What happens within the 90 days? It's important for governments to come together to be able to reassess their health programs. It's important to remember at the end of the day, you must use domestic resources. We must really now dig deep as countries and use our own exchequer financing to support health. That is absolutely pivotal. And then member states, communities, civil society organizations need to come together. We perhaps need to reassess, how are we actually financing health systems in Africa? Are we having wastages, leakages that need to be controlled for? And how do we actually leverage this new opportunity provided by the new American administration to have more effective health systems, to have more efficient health systems? So there are opportunities here, and that's some of the work that we'll be doing in AMREF, particularly in Kigali in March. We are convening the whole of Africa, and this will be one of the things we'll be discussing.